So if we find a patient has a liquid lock or type 3 movement or a disc block subluxation, which is all the same thing, and that is, again, leaning to one side and having a disc shifted there already and not allowing us to lean there, as we see here, what will happen over a period of time, and this is something that you want to explain to your patients because you've got to get them to comply to your recommendations, and they need to know what's really going to happen to them if they don't. And if they don't, this is what's going to happen to them, and it's going to happen pretty much every time. If you have a disc that is shifted over and locked, that spine will wear funny throughout the lifetime of that patient. And what happens is you have big bone spurs that start to grow. Look at the bone spurs here. All because this spine could not lean to that side because that disc is locked over. This person is only 54 years old, probably had a liquid lock since he was a kid. And over a period of time, that spine has buckled and it has not been able to have movement. And again, if we don't get movement in the spine, we do not get hydration. The discs dry out and they become like the heel of a shoe, dead old shoe leather. And if they have this problem now, whether they're young and the spine is not deteriorated, now is the time to get in there, separate those joints, mobilize them, and get that reposition of the spine that we put the rocker in. And position number 1 addresses this problem. Position 1 is mainly used for the problem we talked about earlier, where the sacrum has rocked forward or anterior, and or the fifth lumbar has dropped back. What we're trying to do here is we're trying to push the sacrum, the apex of the sacrum up so that it goes up at the apex, down here, and the fifth lumbar is lifted up. We inflate the lower air cell first, the upper air cell second. And if you do this and you take a lateral lumbar, you'll notice that you will approximate those two joints. And it really is remarkable the relief that you can get using this. And that's position 1. Position 2 is the most commonly used position for the Model 2000, and this position really decompresses the joints a little bit higher in the lumbar spine, and it works on that problem we talked about earlier, described as a liquid lock or type 3 movement. Another way to describe it is a disc block subluxation. We want to have one air cell pull one direction, one air cell pull the other, and that's what this machine does. And it will lift, and it will separate, and it will hydrate those discs. What happens here is we're inflating the lower air cell, pulling the spine this direction in the lower portion, then inflating the upper air cell, pulling the spine that direction. We're separating the joints. We are getting disc hydration. We are getting joint separation. Position number 2, very important for the person with the liquid lock. Position number 3 goes high up into the upper lumbars and the lower thoracics, and we do have some doctors who are actually working down even higher into the thoracic region, and they find that they get a lot of relief for the patient by working on the thoracolumbar junction. Again, we're lifting that junction up and we're separating those joints using the air cells. Again, on all 3 of these positions, we recommend highly that you inflate the lower air cell first and the upper air cell second, and have the patient gently rock on the unit to help get some movement into that joint as the discs are being decompressed.